Have you gone to your GP and had blood tests done and they came back quote unquote normal, but you're not feeling quite right, hair's falling out, you're puffy, tired, any other symptoms, and you're just thinking something must be up? Or the labs are all fine, but you're actually wanting to be more proactive because you heard that disease doesn't happen overnight and there's a lot of biomarkers that you can look at, and they usually start to deteriorate over decades rather than just overnight turning into a full-blown disease after a long time. So today's episode is for you if you can relate to those things. I'll be talking through 15 predictive biomarkers that have been linked in research to optimal health if those markers are optimal, but to gradual decline and not feeling so well, but also all the big ones down the line like Alzheimer's, cardiovascular disease, cancers, if they are suboptimal, not normal. Now, I will distinguish between optimal, suboptimal, and normal throughout this whole class today, this mini class for you, and just being aware that I will be talking about UK reference ranges. There are slightly different ranges in the US and Europe. I will have a PDF. I'll link to that in the file below. Just have a look at that with all the conversions so you can look through what the actual ranges are for your country. Now, I'll be talking about normal ranges. They're the ones that if you go to the lab and you get your blood work back and they're saying, oh, this is you're all fine, that's because they're usually in the normal range. So that's usually a good thing because it means there's nothing seriously wrong, no real issue, which is wonderful, obviously. But we are going a level to the next level. We're going a level deeper today, and we're looking at whether certain markers are actually optimal, not just normal. And that is usually a narrower range that has been shown in research to correlate to actual optimal health, longevity, health span, and just feeling wonderful, not just normal. Now, let me explain the difference between those two ranges. Now, most labs actually, they use their reference range, or they get their reference range by just looking at an average of the population, not optimally healthy people. They just look at anyone that hasn't been diagnosed with a disease, but that doesn't mean that someone might not already be kind of sluggish, slightly overweight, not feeling optimal. Their blood work isn't great anymore, but they just haven't had a full-blown issue yet. So that is the normal range. It takes into consideration all these different people. It doesn't look at what does the body need to thrive optimally. What does it need on a cellular level to actually not start to accumulate micro damage that isn't a problem short term, but over decades and years it can turn into the big issues. Now, we will be talking about the 15 biomarkers in this lesson today that you probably have had in your regular blood work. They're not fancy markers. There are lots of fancy tests one can do, and I surely run a lot of them, but there are 15 biomarkers that actually have a really big impact. If you just optimize those, you will really optimize your health, your longevity, health span, and have a huge impact already without having to go into much more complicated, deeper labs. And the good news is that most of them will be found on your regular blood panel. If you've been to your doctor, you've had an annual with your work perhaps, then you will likely have those markers on there. Okay, so let's dive right in. Number one is ferritin. Now, ferritin, people often know about this as the iron storage molecule, and that's what its main function is. It kind of shows us how much iron there is stored in our body. Now, normal ranges range anywhere from 15 to 300 depending on the lab, depending whether you're male or female. But research shows that optimal is actually somewhere between 60 and 100. You can see that is a huge difference. 15 to 300, much narrower, 60 to 100. Now, let me explain why this is so important. Now, if you are, let's say iron is needed to make red blood cells. Red blood cells are needed, and the iron is needed to put oxygen to these cells and then send them throughout the whole body for energy production. Now, if you are on the low end of that range, you're in the normal range but you're below optimal, your cells are actually kind of starving of oxygen, so they can't do their job well. And common symptoms for that are things like fatigue, hair loss because your thyroid is affected, a sluggish thyroid, having inability to lose weight, just a sluggish metabolism, and just not feeling right. Those are common symptoms of below optimal iron levels. I see them very, very commonly in my female clients that are having a period, a monthly cycle, because they're losing blood. And if they are not eating regular meat, which is also very common. A lot of women try to cut back on red meat. They don't like it. They're vegetarian, they're vegan. They might just not get enough iron back in to keep at that optimal level. Now, on the flip side of that is iron or ferritin levels above optimal. Now, research shows that anytime ferritin goes above 100, and remember, normal ranges can go anywhere up to 300, some labs are even up to 500. Anytime it goes above 100, research shows that this ferritin, this iron accumulation, contributes to low-grade inflammation, contributing to all these big things that we don't want, such as Alzheimer's, cardiovascular disease, and cancer. So there are correlations in different research papers. Now, ferritin above 100 has also been linked to be a marker for inflammation in itself. So sometimes it can be a little bit more complicated. So if your your ferritin is above 100, don't just think it's only the iron that's the cause. There might be something else like a chronic infection that can contribute to that. So you want to work with an experienced practitioner that knows how to read these labs. Okay, so we want to make sure ferritin optimal range is 60 to 100, roughly plus minus. Next up is vitamin D. A lot of people know about vitamin D, really important sunshine nutrient, but it's actually a prohormone and has a lot of functions throughout the whole body. It helps keep our immune system healthy, very important for autoimmunity prevention, cancer prevention, but also keeping our immune system strong to fight off infections. So it's one of these nutrients that just makes sure that our immune system is in that Goldilocks, in the right amount of activity, not underreactive, not overreactive. So very important. It also helps us with energy. But what research shows is that that also has an optimal range where all these wonderful functions actually occur. Normal ranges can be anywhere between 30, 50 to 200 nmol per liter, again UK ranges. Look at the PDF to check for the conversions. But research shows that for this optimal immune supporting function, preventing cancers, preventing autoimmune disease, we actually want that to be above 100, roughly between 100 and 150 nmol per liter. You can see again that's a much narrower range in the top end of that range. Research also shows that there's certain genetic mutations, such as VDR, that can make certain people needing more vitamin D supplementation to get that vitamin D to the optimal level, or that needs certain other mutations that actually need the person to be at the top end of the optimal range to make sure they're actually getting the vitamin D from the bloodstream into the cell to do its function. So just make sure you look at everything all together, but just making sure it's between 100 and 150 nmol per liter is a really good starting point. Third is HbA1c, hemoglobin A1c. Now this is actually an average of your blood sugar over the past 3 to 4 months. It shows how much sugar has attached to your red blood cells, the hemoglobin portion. And that just gives us a good average what's happening with your blood sugar. Now what this doesn't show is whether you have big spikes or dips, because it just looks at the average. But what research shows is that, again, similar to the others, there's a much narrower range that has been linked to optimal health and prevention compared to the big range that the labs use for overt disease. In the UK, a lot of the labs say that anything up to 39 millimole per mole, some even go up to 42, say that that is fine. However, research shows that we want to be a lot lower than that to be optimal. Now, what the labs show for is if you're already pre-diabetic. Now, we're not looking for whether you have diabetes or pre-diabetic. We're looking for optimal health. Research shows that anytime it goes above 36 millimole per mole, it actually already contributes to cellular damage, because anytime there's a blood sugar spike, it actually damages our cells in the brain, in the cardiovascular system, in particular the endothelial lining in our cells. And if that's short, that's just once in a while a little bit, the body can deal with that. But if this happens all the time, so if that average starts to creep up, it means that there's constant micro damage. It's like a rusting of our cells. If that HbA1c starts to creep up, it contributes to that micro rusting, contributing down the line to cardiovascular disease, Alzheimer's, brain degeneration, and all sorts of issues. So we don't want that. Also, from a more vain perspective, it also contributes to things like excess amounts of wrinkles and aging from the outside, because this HbA1c, if that goes up, it is something called glycation that's happening, which is sugar attaching to our cells, not just to the red blood cells, which is measured, but to all of us, to all of the proteins in the body, all the fats in the body, which we're mostly made out of, so it makes us all wrinkly and older from an outside perspective, but also on the inside. That's obviously the most important part. So research shows that actually we want it to be between 31 to 36 millimole per mole. If it's below that, it might actually mean that we're having a lot of dips, which are also not very good. So watch out for that as well. Okay, next one is folate, vitamin B9. A lot of people know it as folic acid and supplementation, or if you've been to, if fertility is one of the things that you are interested in, you might have heard from your gynecologist or doctor that you need to take folic acid. But actually the active form in the body is folate, and it is really important. Now, the ranges are quite big again. Oftentimes they're between 7 and 45, but optimally we want them to be above 30 to 45. Now, what research shows is that folate is important for a lot of different functions in the body. Some of them include give hair growth, for example, but also something called methylation. Now, you might or might have not heard of that. Methylation is a process that is really important inside the body if you are into long-term health, longevity, optimization. Because what it does, it actually tells our body which genes to turn on and which ones to turn off. So really important. We all have some bad genes, we all have some good genes, but it is really about how our genes are being expressed, or which ones are being turned on, what's happening to our health. Now, methylation is one of the factors that is the main switch here, and folate is important for that. So we want to make sure that that is at the optimal level. Now, another marker that plays right into that, and that's another one on my list, is vitamin B12. B12 also is needed for methylation, and B12 also needs to be at the top end of the range. Some research even says that it should be above the normal range to be optimally healthy for brain function in particular. So it's important for methylation, but also has been shown to protect our brain function. It helps nerve signaling, it helps prevent neurodegeneration. So we want both folate, B12 to be in the top end of the range. Kind of as a rule of thumb, it's always good to just look at is this in the top third of the range to prevent decline. Now, both of these, I talked about methylation, both of these are important to get rid of something called homocysteine, because when that methylation cycle works in the body, because we have enough B12, we have enough folate, and there are no other factors that are blocking that methylation, then homocysteine gets broken down. Now, homocysteine is another one of our predictive biomarkers. You might not have that in your normal labs, but it's easy usually to add on. Now, you need to be fasted for that one, really important. But homocysteine is another one of these predictive biomarkers. Research shows that it is highly predictive for long-term health, longevity. Now, the research or normal reference ranges go anywhere, say anything above 15, depending on the lab, becomes a problem. But research actually shows that we want this to be between 8 and 10. You can see again, pretty narrow range, and this is another one of these Goldilocks nutrients or markers. We want to make sure it's not too high but also not too low. While if it's too high, there's direct correlation with cardiovascular disease risk, atherosclerosis, strokes, heart attacks, damage there. Too low levels or below optimal have also been linked to a higher risk of cardiovascular disease, brain degeneration, bone density issues. So we want to make sure that we're in that Goldilocks there. Now, for all three of these, homocysteine, vitamin B12, folate, there are certain genes that play a role here again as well. So for example, there's a gene that's called MTHFR, which some of you might have heard of. It's become somewhat trendy in some circles over the last 10 years probably already, so it's been around for a while. And it helps the body, it basically tells signaling of your genetics on how the body is utilizing folate in order to do that methylation process properly. Now, if people have a genetic mutation there, or there are other genes involved as well, called MTMRR, for example, that help with B12 function, then you might be getting quite a lot of B12 and folate, but your body is still not able to utilize them properly, and so homocysteine might start to build, and that becomes a problem. Now, just one last thing here. Methylation is also really important for brain function, serotonin and dopamine production in particular. And a lot of people are talking about ADHD, brain function issues nowadays, and I'm not dialing it down to just one thing, but it is one of the factors that is crucially important for focus and happiness and motivation, is actually having enough dopamine and serotonin in the brain without interfering substances. And methylation, including having enough B12, enough folate, is one of these factors that is actually a really low-hanging fruit to contribute to better focus, feeling better, and functioning better mentally. Okay, next up is TSH, thyroid stimulating hormone. Now, that's is basically the main marker that most labs run to check for your thyroid function. There are other markers if you want a really big picture of what your thyroid is doing. I usually recommend adding some other markers such as free T3, free T4, thyroid autoimmune markers to make sure there's no autoimmune components such as Hashimoto's that interferes with that. Those are more you can usually get them from your normal doctor, normal labs, but if you're just looking at TSH, which you probably have on any of your blood work, you already get quite a lot of information. Now, research shows that this is actually, again, a narrow range that we want. Normal labs go anywhere from 0.3 to 5. Really depends a little bit. Some go up a little higher, lower. But research shows that for optimal health, we want to be somewhere between 0.5 and 2.5. Some say even narrower, between 1 and 2. But actually what some other research shows is that if you just look at optimally healthy people, most of them are in that range from 0.5 to 2.5. If you're slightly older, above 70, you actually want to be slightly in the higher end of that optimal range, around 1.7, 1.8 to 2.5, because actually it seems that there's a preventative effect if your thyroid function is not overreacting. Now, research shows that if the thyroid, the TSH, is above optimal, it's already linked to a sluggish thyroid, contributing to cardiovascular disease risk, metabolic health risk, and a lot of other problems. So make sure that is in the optimal range. Next up, big inflammatory marker, and a lot of people know about the health effects of chronic inflammation on the system, on longevity, on optimal health, is hsCRP. It's high sensitivity C-reactive protein. Now, normal labs are anywhere between 3, but optimally we want that to be below 0.5. Now, what happens if that hsCRP goes above 3? It means there is overt inflammation, proper inflammation happening. This can sometimes happen if you have an acute infection, because remember, and I've talked about this in other episodes, inflammation is actually a good thing. We need inflammation because that's our immune system's response to infections, cuts, wounds, and it sends signals there, inflammatory molecules, to fight off the infection, to heal the wound. So we want that short term. Acute is really important. So if the hsCRP is really high, it usually means that there's maybe some acute infection. If that hsCRP is below normal but above optimal, it means that we're having chronic low-grade inflammation that has been linked to all these sorts of ill health issues that we've discussed in other podcast episodes. One of the big ones is that inflammation is one of the hallmarks of aging, so it's been linked to all sorts of bad health down the line: cancers, cardiovascular disease, Alzheimer's disease, but also short-term or in an earlier age, things like PCOS, endometriosis, anxiety, skin issues, all these things that just deteriorate our quality of life. Low-grade inflammation is a big marker. Now note, really important, that I often see people having some chronic low-grade inflammatory other factors. They have certain infections that are chronically inflaming them. They have PCOS, those kinds of things. But CRP might still be an optimal. For that to rise above optimal, you need quite a lot of inflammatory factors happening. Another inflammatory factor is uric acid. Has also been shown in research to be one of the predictive biomarkers, meaning that it has been linked to all sorts of health outcomes if it is just optimal and we're making sure we're tracking it over time. Now, normal levels can be anywhere up to 420, and only when it's above that it's being flagged. Research shows that it actually ideally is below 360 at the very least. Better yet, maybe even below 300. So there's some research is not that sure about it, but I always like to go for the optimal level if you can, but don't stress if it's between 300 and 360. But if you can get it below 300, even better. Now, reason being is that uric acid is actually an inflammatory marker as well. If it is really high, it is linked to gout. That's what you might be familiar with. But on a not that extremely high level, but just on an above optimal level, it has been linked to cardiovascular disease, in particular strokes, heart attacks, those sorts of things, damaging our endothelial lining, our cardiovascular system, our blood vessels basically, and then also contributing to metabolic issues, insulin resistance, so issues with blood sugar balance, those sorts of things. So make sure you keep that in the optimal range. Next one is GGT. You might have seen that on your liver panel. So again, normal, absolutely regular marker that is usually tested to check for liver function. Normal ranges for men are usually below 55, for women below 38 roughly, but optimal research shows that for men we want that to be below 15 and for women below 10. The reason this is so important is that it's not just a liver function marker. It actually is also a marker for cellular damage. Reason is that GGT is needed to produce something called glutathione. Glutathione is our master antioxidant that gets rid of free radical damage inside our body. We produce glutathione ourselves. We can add a little bit of supplementation to boost it, but we can make it from certain precursors such as cruciferous vegetables or protein-rich foods. But what research shows is that if this GGT starts to creep up above optimal, it means that there's a higher load of oxidative damage, free radical damage happening, and we're burning through our glutathione, and the body isn't quite able to keep up with the production any longer. So it starts to produce cellular damage. So that is not a good thing for long-term health and optimization, obviously, health span. Research also shows, and this is really interesting, is that centenarians, the people that turn above 100, seem to be having a really low GGT. So it's one of these centenarian markers where they found that centenarians all throughout the world have a really low marker. Number 11, next marker is HDL cholesterol. Now, there's a lot of other markers that play a role into our cardiovascular health. I already addressed some of them, such as inflammatory markers, homocysteine, uric acid. But obviously, if you want a bigger lipid panel, there are much more in-depth markers such as lipoprotein, oxidized LDL. But a really simple marker that most people already have, that already kind of help predict health outcomes, is HDL cholesterol, the good type of cholesterol. Normal ranges in normal labs are anywhere from 1 to 1.2 in women. 1 is usually for men, 1.2 for women. Above that should be normal. Research shows that for optimal health, we want that to be above 1.6. Now, what that does is HDL actually seems to have a preventative effect. It helps to transport the bad cholesterol back into the liver. So that is a really important cleaning up mechanism. Second one here, marker number 12, are triglycerides. Again, you've probably seen this on your regular blood panel, and they are also one of the predictive biomarkers that tell us a lot about our cardiovascular health, but also metabolic health. Normal labs say anything below 1.7 millimole per liter is probably fine. Optimal, we want that to be below 1 millimole per liter. Reason being is that if it creeps up above 1, it's already linked to a higher risk of cardiovascular disease, metabolic syndrome, insulin resistance, because one of the factors that actually, or some of the factors that increase triglycerides are eating too many sugars and carbohydrates, having alcohol consumption, and just overeating in general. So it's a really simple marker to check whether you're kind of fooling yourself into thinking you're eating the right things. It's actually quite... You can really see the correlation usually. I see this in my patients. They say, oh no, I eat really well and I eat really healthy and I don't overdrink and I don't overeat. And I'm the last person to judge ever. I'm always on your side. But I know that sometimes people fool themselves. And this is one of the markers that is just really directly correlated with what are they actually putting in their food and in their mouth. Maybe they are overeating, and that is sabotaging their health and their weight loss and those kinds of things. Okay, big last section, 3 markers, sex hormones. And they are slightly complicated. There are different factors associated with them. So we will be talking about estrogen, progesterone, and testosterone. All 3 of them exist in both women and men. So often people just think, oh, testosterone is the male hormone, estrogen and progesterone are the female hormones, but actually both make some of them, just at different amounts. Testosterone is more of the male hormone that produces a lot of the male features, estrogen, progesterone, a lot more of the female features, but we need both of them. However, for today's session, we'll talk about estrogen and progesterone in women and testosterone in both men and women, because research isn't quite as clear-cut for estrogen for men quite as yet, and progesterone in men, what the optimal levels are yet. So if you are in the normal range for estrogen and progesterone as a man, and your testosterone is optimal, you're likely on a good track already. And if there are any issues, you can look at that in more detail with a practitioner. Okay, let's start with women. Let's start with estrogen and progesterone. And initially, let's start for premenopausal women. So women between teenage years to anywhere in their 40s, 50s that have a cycle. They're called premenopausal, so they're before menopause hits, when the period stops. And the best way to look at hormones at that time is actually around day 21 of your cycle, with day 1 being the first day of your period, if you have a regular plus minus 28 day cycle. Reason being is that we have this really intricate interplay between different hormones at different parts of the cycle, and in the second part of the cycle we really need progesterone to play a really big role for health optimization, and we can measure that best around day 21. Now, I used to also look in depth at estrogen in the blood, my premenopausal women, but what research really shows is that for peri and premenopausal women, so all the women before menopause, estrogen doesn't really play such a big role for health optimization as long as it is in the normal range, broken down into a good version. I'll talk about this in a second a little more, and opposed by enough progesterone. So it seems like it's actually the breakdown of estrogen that matters more for health optimization and prevention, and if there's adequate amount of progesterone to counterbalance estrogen out, as long as estrogen is in the normal range. Because there's a lot of talk about estrogen dominance in the functional medicine world, and that is a thing, but it is mostly really about, is there enough progesterone in kind of correlation to estrogen? It's not so much about the total estrogen level in itself if it's just in the normal range. There's some research that shows that anything above 1,500 of estrogen might turn into an issue. But then there's other research that shows that actually, as long as progesterone is optimal to oppose it, it's even if it's above the 1,500 but still within the normal range, it's perfectly fine. No cancer issues, for example. Now, what is the optimal progesterone range? Ideally above 31.8 in the UK ranges, around day 21 of the cycle, when it really peaks post-ovulation. Now, that is the range that has been shown to counter the bad effects of estrogen. Now, both of them are important. Estrogen is actually really crucial for us, for bone density, for brain health, for skin health, for feeling good, for making our hair glowy and shiny. So estrogen is wonderful. We just need to make sure that we have enough progesterone in that luteal phase, in that second half of the cycle, to counterbalance it, because estrogen makes things grow. Progesterone kind of puts the brake on and says, not too much, don't overgrow, don't contribute to fibroid cysts, all these kinds of things, cancers. So progesterone, important one. Progesterone is also really needed for proper fertility, in particular in that second part of the cycle. So important here, it's more about progesterone, total progesterone levels than it is about total estrogen levels if you're before menopause. Now, what does matter is how the body's breaking down estrogens. There are 3 types, just quickly. It's beyond the scope of today's session, but there are 3 types the body can break down estrogen in. One is called 2-OH, one is called 4-OH, and one is called 16-OH. And 2-OH is the protective form. 4-OH is the really bad one. It's kind of really aggressive, and it can damage your cells, cause free radical damage if the body isn't able to quench it enough, and that has been linked to a higher risk of breast cancer, for example. And the 16-OH breakdown is actually the one that we often confuse with estrogen dominant symptoms. They are this very proliferative estrogen metabolite that contributes to things like endometriosis, fibroid cysts, and those kinds of things, blood clotting. So you want to, if you're really worried about estrogen being your issue, you want to make sure you actually look at how is the body breaking down estrogen, best done in urine, such as I like the Dutch test. It's a dried urine hormone test, and you pee on a little piece of paper 4 times throughout the day. You also get your stress hormone levels measured and lots of other wonderful markers. But that one just gives you a really good overview how the body's actually breaking it down rather than the total. Now let's go to menopausal women, where actually estrogen in blood levels are already an important marker for preventative longevity optimization benefits. Now, what research shows is that if women are on HRT, hormone replacement therapy, post-menopause, when they've stopped having a cycle, they actually benefit from that hormone replacement therapy pushing the estrogen up to around 220 to 400 pmol per liter. Now, estrogen should be bioidentical to be beneficial, and there's also other factors that play a role when you initiate that hormone replacement therapy. For example, ideally you initiate it in perimenopause when hormones start to fluctuate, ideally within 5 years post-menopause to get all the benefits and no potential side effects. You want to make sure it's dermal estrogen, so any gel or patch, because the way it's being administered has actually been shown correlated to risk profiles, whether it contributes to a higher risk of thrombosis, for example, blood clotting. So all these things that we're often worried about with estrogen replacement therapy often has to do with the age of when you started, of initiation, and also how you administer it, gel, oral, or the version of it, whether it is the old school version is actually from horse urine. The new version is made in the lab, but it's bioidentical. It looks exactly like the one that we make ourselves. So research shows that if we get it between 220 and 400 pmol per liter, we have optimal bone density benefit, brain benefit. It helps mental health, skin, cardiovascular disease risk, big one. So a lot of women that have low estrogen and are not on HRT have their risk of cardiovascular disease jumps up post-menopause. And if you're really into longevity, health span optimization, you might want to consider HRT at the right levels. Above 400 and at very least 550, there's a higher risk of side effects. If you have a uterus, you also need to add progesterone to prevent any proliferative issues from that added estrogen, such as cancers down there. Now, third is testosterone. Testosterone for women first, finishing up the hormones in women section. Now, testosterone for women is actually a really important marker as well, and I look at that in a lot of my clients, or I look at it in all my clients, but I see it below optimal in a lot of my clients. Now, testosterone is needed also for bone health, also for mental health, really important for libido. So a lot of women come to me and they say they just don't feel like it anymore. They've lost that interest in their partner, and that can really contribute to a decline of quality of life and quality of relationships. Now, testosterone also helps with being able to build muscles, metabolism, tone up. So overall, it helps with quality of life, but also with longevity and health optimization. So testosterone, normal ranges for women, anywhere between 0.5 to 2.5 or such. However, research shows that we want that to be around at least 0.8, ideally above 1 to 2 or so. For postmenopausal women, you want to be at least at a 0.7. Research isn't sure whether there's extra benefit if you go up to 1, but ideally 0.7 to have these benefits. Okay, last but not least, testosterone in men. There's a lot of talk about this, and at some point I'll make a bigger video just on that topic. But testosterone in men is really important for cardiovascular disease prevention, metabolic function, but also looking better, feeling better, having energy. If that starts to decline, you lose your manliness, quote unquote. You might feel a little bit more weepy and tired and overwhelmed, and find it harder to lose body fat, having less strength, finding it harder to build muscle. But like I just said, from the inside is actually really important for our cardiovascular metabolic health panels as well. So really important getting that testosterone into optimal ranges. Now, normal ranges can go anywhere from between 8 to 30 nmol per liter. Research shows to have optimal health and optimal cardiovascular risk protection, diabetes protection, we want that to be above at least 17 nmol per liter. Some even go up to saying it should be above 20, but if you get above 17, you're likely at a really good level already. Now, the really important part for testosterone, both for women and for men, is to also measure sex hormone binding globulin, SHBG, because that shows how much of the testosterone is actually free and active and can do its job, and how much is bind up. So that is really important to actually look at what's available to the body to use. So add that if you can, simple markers. Okay, so those are the 15 markers that you likely have on your blood panels. Homocysteine maybe not, but it's simple to add. And just look at these ranges. Go and click at the link below to check for the actual for the PDF with all the reference ranges. You can just download that for free, and it has all the reference ranges to science, but also all the actual reference ranges for the labs. So just have a look at that. Now, where do you take it from here? People always ask this, and if you're just trying to optimize your health, I always say step number 1 is make sure you go to your GP if you don't feel well and get yourself checked up first. Don't just try and doctor yourself through online, social media, ChatGPT. Go and actually get it checked out by a professional. Make sure there's nothing sinister underlying anything that might not be right. So if any of the ranges are actually outside of range, also important, go and get it checked out. If you've had it checked out and you want to optimize, and you can look at these ranges, I will do different videos on how you can actually optimize them, not today's topic. And then in addition to that, you can always work with someone that is into longevity, functional medicine, health optimization. Like myself, I see clients remote over the world and also in person in London, and we look at all these things, but we also look at the underlying factors that might be contributing to things not being optimal, because there's always a why. Why is there inflammation? Why is the body not producing the right amount of hormones? Why isn't the body absorbing certain nutrients? All these kinds of things, there's usually a why. And if you really want a comprehensive health protocol, you want to look at where is this actually coming from, rather than just adding in an anti-inflammatory supplement or adding in an anti-inflammatory medication, blood sugar dimming medication. You want to make sure you're actually looking at the deeper cause, so that you can turn this into a lifestyle that optimizes your health at a cellular level, not just suppress it from a different angle if you had this blood work done. All right, I hope you found this helpful. I would love to hear from you. Comment below, please.